Hey guys, I'm Hedi and I had blood cancer in 2017. I'm gonna make this channel in English because all my friends are speaking English. I tell my story not so that I get glory, but so that others may know hope. I think I've watched all the cancer-related YouTube videos, and now it's my time to share my story. I caught it early enough, but some of my friends didn't, and this is why it's important to raise awareness and talk about the symptoms, the signs. Symptoms can be swollen lymph nodes, lumps, skin rash, fever, shortness of breath, weight loss, so a lot of different symptoms that can be missed by the doctors, as it was in my case too, which is crazy because Hodgkin's lymphoma is the most common cancer in people our age. When people hear about blood cancer, they think it equals to leukemia, but there are two other types of blood cancers too, lymphoma and myeloma. I got myself this tattoo in the beginning of 2017 when I had no idea that I was already sick. I was an ordinary 33-year-old girl who worked as a casino cashier, that time in Casino Wien. I enjoyed my life. I loved my job, I loved my dog, loved traveling and eating good food, but as we know, good things don't last forever, so something has changed. I started to have chest pain always at night, and when I went to the doctor, I was told it was for sure caused by stress. This chest pain was so strong that sometimes I ended up in the emergency room. I was also sent home from there without finding out the answer. In summer, I always go swimming, and this summer I realized my back started to be full of pimples that never ever happened before. So I had a kind of a rash that was just getting worse. And after a while, I discovered a lump on my collarbone that actually you don't see on the picture because it was so tiny, but I could feel it with my finger. I went to the doctor. I told him it was not painful. His answer was, it should be fine. I also started to have migraines, and sometimes they were so strong that I was throwing up, even at work. So I decided to go back to my GP and have a referral to an ultrasound for this little lump on my collarbone and get it checked out. He was not agreeing with this. He told me it was completely unnecessary, but I told him I don't really mind. I just want to get it checked. Summer was already over by the time the ultrasound took place, and the radiologist was shocked. He told me my body was full of swollen lymph nodes, and he was sure, 99% sure, I had cancer. He sent me to see an oncologist who also checked my neck and the lump on my collarbone, and I had to undergo a mini surgery to take one lymph node out to check if it was cancerous or not. I had to wait for the results about 10 days. You know, it's a long time when you are waiting for such big news, but I spent it with my dog, hoping for the best, but expecting the worst. The test results came back positive to cancer. My diagnosis was stage 2 Hodgkin's lymphoma. Hodgkin's lymphoma is a cancer of the lymphatic system, which is part of your immune system, and the cells in the lymphatic system grow abnormally and may spread beyond it. The diaphragm is a thin skeletal muscle that sits at the base of the chest and separates the abdomen from the chest. There are 4 different stages of Hodgkin's lymphoma. Stage 1 is when the lymphoma is found in one lymph node region. Stage 2 is when the lymphoma is in 2 or more lymph node regions on the same side of the diaphragm. This was my case. Stage 3, when there is lymphoma in the lymph node areas on both sides of the diaphragm, meaning above and below it. And stage 4 is when the lymphoma has spread to 1 or more organs beyond the lymph nodes. Hodgkin's lymphoma usually spreads to the liver, bone marrow, or lungs. It's not the type of cancer you can treat locally, like taking out tumors, but you have to target the whole body. The pain in my chest was caused by a 5 centimeter big swollen lymph node pushing my lung. So I had to start chemotherapy straight away. My next surgery was the portacut surgery, where they installed this medical device beneath my skin, and it provided direct access to a central vein, so through this I could get my chemotherapy drugs. Then I had to have a bone marrow test to check whether there were cancer cells in my bone marrow, which was quite shocking and painful because here in Austria they don't use any anesthesia. Marrow and bone samples are usually taken from your hip bone. The doctor uses a hollow needle to remove a small amount of marrow cells and a small piece of bone filled with marrow. This is what you can see on the photo, my bone marrow in a glass. The protocol for Hodgkin's lymphoma stage 1 and 2 is ABVD chemotherapy. A few hours after my first chemo, I felt like if it was the biggest hangover ever. Until I was still in the hospital getting IV drugs, I was still fine, I would say. But then when I arrived home and I got all these meds prescribed for each and every scenario, I started to feel worse and worse, and I felt that things are getting worse. After a few hours, I was not able to take any of my meds because I couldn't swallow at all. I couldn't swallow not even water. I was shaking. I was in very much of pain. My jaw felt like someone was ripping it off. It was horrible. I had to be admitted back to the hospital again. In the hospital, I asked for morphine. So they gave me 2 morphine shots into my bum and they didn't work. And actually from that point, I don't really remember anything because I was in and out of consciousness for about 1 month. I had a life-threatening allergic reaction to the chemotherapy drugs, and this allergy caused my throat swelling and unfortunately a bowel obstruction too. I woke up having catheter and tubes everywhere. I also had a stomach tube and they were feeding me through this in these few critical weeks while I was not conscious. So after this, you can imagine my hair falling out was the least of my problems. I had to relearn eating and walking, so I had no time or energy to think about my hair loss. I just accepted it as the weight gain too that was caused by the steroids. Chemotherapy drugs also harm normal cells, including cells in the mouth, so I had mouth sores. My whole mouth was basically inflamed, sometimes even bleeding. Because of my allergy, we had to change the chemotherapy regimen, which meant switching from ABVD to BEACOPP, which is the regimen for advanced stage Hodgkin patients. And because this regimen is for the end stage, it really took a toll on my body. I got weak, I was in a wheelchair, I lost my voice, I had skin rash, I gained weight because of the steroids. So it was not easy, but at least it worked and I didn't have allergy. My wonderful dog has been waiting for me for months and months to get better. He was always by my side when I was at home, and missing him was the worst thing during my hospital stays. My heart beats for dogs, and with him, we really have a special bond. I got my last chemo on the 27th of December 2017, and I had my lowest point on New Year's Eve 2017. Because my last chemo damaged my nerves, so I didn't feel my toes, I didn't feel my fingertips. This means I couldn't open a door or I couldn't do anything alone. So the recovery took a long time, but things were starting to get better. There were short-term side effects and there are long-term side effects. Chemotherapy has damaged my organs like my heart, my liver, and also damaged my nerves. I've been taking meds since then, but as my oncologist says, this is the price of survival. I'm very grateful for my doctors and nurses and for all the people who had even just a kind word or a smile to me when I was miserable and vulnerable. I would have never thought I would get diapered at 33, but I was, and I'll be forever grateful to the nurse, Martina, who saved me from a bowel surgery. A few weeks after the last chemo, my hair started to grow, and I was so happy. I photographed it almost every day. I'll be forever thankful to my ex, who has been there for me, loved me, and supported me. I feel so lucky to have my cancer friends, and if I could, I would love to hug all the fellow cancer patients around the world. Usually when people hear my story, they ask if it's gone, and the cancer patient has to be careful with the answer because it's not a flu. Cancer is treatable but still not curable. Every few months I go for my regular scan, knowing full well that one of these times I'm gonna hear some bad news. But until then, who's in charge? Me. That's how I live my life. If you want, you can find me on Instagram. My name is Hedi and I.